All right, so for this next one, this is going to be a posterior cuff activation exercise. So I'm going to show you with two variations here, one with the TRX and then a second one with a band. So in general, I like to start with the TRX because it gives you a little bit more time to figure out your position. If you don't have that, though, I'll show you with the band. The only challenge with the band, so you're aware, is that the band is going to want to fight against your resistance. You're going to have to go with a lighter band. So starting with the TRX, you're going to want a towel for this. Towel is going to go underneath your armpit like so. TRX is going to be at your side. So the movement you are trying to do is you're trying to do this external rotation movement out this way here. We don't want that full movement. We just want to create tension in this neutral position here. It's what we call an isometric. So you're going to get yourself set. So your wrist is stacked over your elbow. You're at this position here. Shoulder blade is down and back. And all I'm doing is I'm trying to create that external rotation movement out this way. But no movement is going to occur. So you start about 10 to 20% effort. You go ahead. You start building up here. Ideally, where I want this to be felt is in the back of the shoulder right here at that rotator cuff. What I do not want is I do not want tension on the front of the shoulder nor on the side of the shoulder. That's telling us we're not getting activation in the right area that we want. So that's why I like sort of the TRX here is you can take your time to find that position. And if you struggle with it here, what I would recommend is you step in a little bit more so you're in a little more of this out angle here, more external rotation, and it's going to be a little bit easier. Like for me, I already feel kicking on right there. And we're going to hold that for the designated time. And that's really it. So you relax, then we go ahead, we do that again. We push into that about 30-40% effort. We're going to hold that for 10 seconds. And then we relax. So that's for the TRX. Again, the nice thing about the TRX is it's not going to pull you back. You can gauge your own intensity there. With a band, you're going to get a little bit of some eccentric quality, meaning that band, when you go out with tension, it's going to want to pull you back in. So it's going to make it a little bit more challenging. So all that means is you might just need to start with a lighter band if you don't have a TRX. So what that is you keep that shoulder blade down and back, and you just get to that position there. And if you feel it, great, you just hold it. Just know that might be a little bit of a harder 10 seconds than with the TRX because that band's going to want to pull you back in. But again, the most important thing here is that you're feeling it in the right spot. I do not want tension on the front of that shoulder, where that bicep is. I also don't want tension on this kind of side here where you might be getting a little bit of a pinch on that supraspinatus, one of those cuff tendons. This should be all back of shoulder right here more than anything, along this line here.